When I was in my first year of nursing was the first time I ever experienced burnout. It hit me hard and fast, and it's been something that I have personally experienced many, many times over the years. It is extremely challenging to focus on a handful of tasks at a day. We are always pulled in many different directions at a time, constantly forced to reprioritize and readjust our schedules.
When I started as a young nurse, we had a ratio of 4-to-1, so 1 nurse to 4 patients. It's gone up to 1 nurse to 6 patients.
We're seeing a lot more complicated clients come into their homes. We're seeing a lot more advanced wounds, that kind of stuff that used to be maybe in the hospital for a little bit longer. There's just not the beds for that.
Certainly nurses across Alberta right now are struggling. They thought it was really bad during the worst of the COVID pandemic, and it's absolutely tragic that it hasn't gotten any better.
It is very uncommon that nurses are able to take all of their breaks, if any breaks, in day-to-day. Personally, throughout my 5 days at work, I usually get 1 break throughout the entire week.
To be a nurse, we're a team. We work together, we bounce things off of each other, we educate each other. It's a family, and I think we all need to work together to make sure that the public and our patients are healthy and cared for.
Unions exist for a very good reason. One person can't do a whole lot in terms of their employer. They're completely disempowered. But when we all come together and have that voice, then they have to listen to us.
Solidarity is a key component because being a nurse can often feel extremely lonely and disheartening.
I think the sense I see is more passion with our members. I think in previous rounds I haven't seen as much engagement with our members as it is now. People are calling and texting and emailing to see if I know any more than they do. So I think that's a big thing that I've seen this time around.
Without massive changes today with recruitment, retention, and respect for nurses, I do not see healthcare improving.
And that's what this whole process is about. It's over 30,000 nurses who are coming to the table and saying, we demand respect.